Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, should doctors be able to apologize for maybe a mistake they make and have some of the consequences mitigated as a result of that? And how about a consumer update? All of that and more following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Joining me, as often is the case, is one of the healthcare experts we have on this program from time to time to set us straight about healthcare matters. Sitting right across from me, Dr. Stuart Shapiro. He's the president and CEO of the Pennsylvania Healthcare Association. And joining him is someone who's been too long a stranger, Senator Pat Vance. Her district's number 31. We don't care about that. But Cumberland County mostly, right? You got some
all of Cumberland, Northern York.
And we want to throw Northern York in
Absolutely.
there for our viewers in Northern York. All right, look, we're going to talk about this apology legislation, and it's important. It's sort of growing. I'm hearing more and more about it. We'll let you get into that, Senator. But let's do a quick sort of round the policy table. Stuart, we've talked about this before. Barack Obama says he's coming back with health care. It's his major agenda. And he's selling it now, or arguing that this is our way out of the recession. Take health care savings, put it into health care, more people get covered. Am I right or am I wrong about that?
Well, we certainly, Terry, have close to 1 million people in Pennsylvania without health care. And we have to do something about that. Whether this ought to be done this year at the state level or the federal level is up for debate. And we're in a recession, and whether we can afford health care, because the reforms are going to take several years, is a question that needs to be debated. And I'm glad that I'm sitting next to Senator Vance, because she is really Madame Health Care.
Yeah.
She's the only nurse in the legislature.
That's right, former health care professional. Can I say former? You're not still practicing, are you?
I'm not, but it's just like being a mother. You're always a mother.
I understand.
You're always a nurse.
I understand. I know everybody calls you when they have some question about policy. Go ahead.
But she really does understand the system. And when we talk about apology legislation, she understands how important the communication is. So you ought to ask that question to her that you just threw at me.
Well, okay, I'm going to get to that, but no doubt about it, it's Obama's #1 domestic priority after the recession. You agree with that?
Probably.
Okay, you want to say something? Go ahead.
I do. Oh, well, you notice that he turned it over to the legislature to make that decision, which tells me that perhaps we're not going to see progress as quickly as had been anticipated.
Well, there are different proposals. You know, the Max Baucus, I guess he's turned it over to him in the Senate, who's been spending a good bit of this last couple of years weighing and negotiating it. But all right, let's turn to Pennsylvania. Boy, I'll tell you, we've had a lot of health care activity. We've had Governor Rendell's plans to cover more Pennsylvanians. He started out with 800,000. He went to 250,000. It's now fewer than that. Where do we stand in the efforts to broaden coverage at the moment? Where would you say we stand?
I think there's some issues of which the legislature and the governor agree upon. For instance, to allow children up to the age of 29 to stay on their parents' policy. I don't think there's any disagreement about that.
Now, how would that work? I mean, is that in all private and well as public plans?
It would be if this passes. There are definitely insurance plans now that already allow that. So
that's a pretty good idea, isn't it?
Absolutely.
Mini COBRA, because now there's no COBRA for employers of 20 or less of a company. So on these things, we agree.
And the stimulus would pay for 65% of it of coverage for 18 months, but doesn't that come back on the employer?
Absolutely. A lot of the stimulus money that sounds wonderful, we're going to fall off that cliff in 18 months. And once people have a benefit, they consider it an entitlement, and it's very difficult to take it away.
Now, one of the things that the governor's talked about, and then we'll get to the apology legislation, one of the things the governor has been complaining about has been this growing list of folks who are now lining up for coverage for what they call adult basic. You know, that's the coverage for people who earn too much to be on Medicaid, but not enough to pay for insurance themselves. And Stuart, I saw that list as something like 180,000. Is that anywhere near right? I mean, that many
big list, Terry, and it's getting bigger as the recession moves on. And there are solutions. And There are discussions between the Senate and the House and the governor about how, even given this recession, what we can do in Pennsylvania. But the critical issue for the people on Medicaid today is that the governor not divert state dollars, which he was planning to spend on Medicaid. Now he's going to get some federal stimulus money that will increase all the what's called the federal match. But that he not divert those health care dollars away from health care, away from serving the elderly, and start to spend it on roads and other things. And that's something that we're pushing very hard on.
Yeah, as I understand it, there were at least earmarked something in the neighborhood of $4 billion over the next couple of years for health care spending. Now, it's not all that would go directly for services to folks with who need coverage. Some of it would be for electronic
medical records,
and other things. Have you started that debate in the legislature yet about?
We had a debate at the end of last session and probably continuing in this one. There's no question that the recession has produced more people seeking health care. However, I guess I disagree with the governor's plan for several reasons. First of all, the method in which he does adult basic. He waits till there's a large number of people have moved off, and then he makes an announcement, rather than one goes off adding another. He is proposing to do pharmaceuticals and behavioral health and says it's going to cost less. Now, I find that unbelievable that you can add those benefits and the benefit would cost less. We have been pushing for some time clinics and believe we could serve a great many more people with clinics. The Sadler Health Center in Carlisle is a beautiful example of what can be done. I think we've got to get away from the notion that we have an insurance card. That does not necessarily say that you have access to health care. If we look at Massachusetts, they passed that plan. They have insurance cards. They can't get health care. We need to do very preventative health care, and we need to make sure everybody has access.
We're going to go to break, and then we're going to take the next part of the program devoted entirely to this apology legislation, which is important and also intriguing, I think, as a concept. More and more people are talking about it. We'll be back following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back with our health care expert, Dr. Stuart Shapiro, and State Senator Pat Vance. Senator Vance has a piece of legislation that I've been hearing a lot more about. It's called the apology legislation. And I'm going to let Senator Vance and Dr. Shapiro sort of get into this. Okay, first of all, what is apology legislation?
It gives not just a physician, but any healthcare practitioner the ability to say, I'm sorry, it was unintended. To make a benevolent gesture is really what I've called the legislation.
Yeah. Now, Stuart, look, you know a lot about this subject probably as much as anybody. When you're treating a patient, doctors are just fearful to say, I'm sorry. I may have done, maybe it was a mistake of judgment. Who knows what it is because of the consequences. And that makes them appear, distant from their own patients, right?
Well, we have a problem in the healthcare system. Doctors and patients and nurses and patients have stopped communicating. And they've stopped communicating with families. And they're worried about things going awry. Not necessarily a mistake.
Right.
Things happen. And so now, rather than just walk up to the patient and say, I feel terrible that such and such an outcome happened. No one may have made a mistake.
Right.
They don't do that. They clam up.
But you're afraid if you say you're sorry, it will be interpreted as a mistake.
Correct. And that's what Senator Vance's legislation addresses.
Okay.
If mistakes were made, people can sue. In fact, they can sue without mistakes being made.
And often do, by the way.
And often do.
I'll get in trouble for that.
But those suits are motivated by anger, not greed. And if someone would simply say to them, this happened, I feel badly, and this is why it happened.
Right.
People don't sue it. In fact, some statistics are really interesting. In Michigan, where they developed this program, suits fell by 2/3. In Illinois,
wow,
by 50%. And right here in central Pennsylvania, a group of doctors, a 1,000-member captive insurance company, they're trained to not deny and defend. They don't say, I'll see you in court. They say, I'm sorry.
Right.
And there's a book written by 2 lawyers in Lancaster County that talk about sorry works. And
sorry work, yep, there you go.
And that's why it's so important that Senator Vance's legislation get passed.
Let's talk about another aspect. Let's go back to the liability aspect. And in what way does this legislation not impinge or impede any liability possibilities for plaintiffs?
Well, it doesn't necessarily say there still can't be liability. Let's say you're the physician and you say to me, I'm really sorry, it was a mistake, or not even it was a mistake, it was an unintended consequence. That cannot be admitted into trial, but anything after that can be. So that doesn't preclude someone from wanting to sue. But when you put yourself in the position of either the person who was injured or the loved ones of someone who was, they just want somebody to admit culpability. And I think that it would go, it's not the end all, but I think at least 22 states, and I think there more have come on already, have this in law. Now, most of that have been very recently, so the statistics are not yet totally evident, but it seems to be working, and it's certainly supported by physicians, by the hospital association, by nursing homes, because it would apply there as well.
Yep. Now, again, I'll turn to you because of your direct medical experience. Wouldn't it be better for a physician or a nurse, whoever, to have this conversation with someone in an open and frank way about their health care without this impending fear that when they get into this discussion, there's this sword hanging over their head?
That's the whole purpose of the legislation.
Exactly right.
That's what it does, takes the sword away. In fact, in the last year or so, that number has now increased from 22 states to 35 states, including Delaware, Maryland, and Ohio. So
our neighbors
can do this.
In New York.
And New York also. But this simply says, let's have some open communication. Let's make our health care system more consumer-centric and less driven by the fear of malpractice.
I'm supposed to be neutral. There are some things that I get in trouble because I don't always stay as neutral as I should. But this seems to make so much sense. I mean, it doesn't even, so that leads me to another question, which is prospects for passage.
Well, as you know, the committee chairman of any committee makes the decision whether to move the bill.
Is it in?
It is not. It's in Judiciary Committee, and it's Stuart Greenleaf.
In the
Senator
Senate?
Greenleaf, yes.
And do you have any prospect that it will move out of the committee? You're smiling, I mean.
We certainly hope so. My guess is that perhaps the trial bar has some concerns.
All right. But 35 states now have it. It still leaves one with the possibility of going into court and doing the doing the liability claim. I don't understand if they take the legal, maybe someone from, do you know, I shouldn't ask you this, but I will. What possible argument would be against this, either of you? I mean, what are the arguments that you hear?
No one has come to me directly that's opposed.
Really?
No.
The trial bar likes to sue. That's what they're there for. And
and this will cut down, I get it. Even I can now figure that out, if it cuts down the number of lawsuits. This may cut down people coming to them and saying, I want to sue. Yeah.
And it's sort of like other advocacy groups. They're afraid of a little progress because it could lead to further changes.
All right. Well, we're going to follow this, and if there are changes in this, you give us a call. We'll have you on. We're going to follow this. I think this is an important piece of legislation. Improve relationships, strengthen relationships between doctors and their patients and other folks in the medical profession, other healthcare providers. All right, consumer update. How are consumers feeling? Oh gosh, do we really want to do that? But we'll get some positive statements out of our next guest after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Joining me is Brian Reiter. He's the president and CEO of the Pennsylvania Retailers Association. We're going to talk a little bit. You know, I promoted this and said good news. We're going to find some good news at the end of these, at the end of your appearance here. But let's talk more directly about the consumer situation. Consumers are now saving instead of spending. Consumer confidence is not very good. I guess retail spending, consumer spending was down, was it 1.1% for the first couple of months? Give us sort of your feel for all, you know, that subject.
Well, as you had let off with Terry, consumers are saving more in the last 12 months, which we feel was necessary because savings had been at a negative level for some time, and it was necessary for the economy to have consumer savings. But spending is not at the level it needs to be to get us out of this recession. March sales numbers just came in nationally, and they decreased by 1.1% for the month of March. February numbers were up, but only because the expectations, they were anticipating that February numbers would dip 0.1%, and they were up 0.03%. So it's really
But this
difficult.
still isn't a lot of, this isn't customarily what we would see with consumer spending in our country.
Absolutely not, and it's not indicative of any signs of getting us out of this recession yet.
So let's frame this another way. Most economists that I've read say we will not get out of this recession until we get consumers spending again. Notwithstanding the fact that they ought to also save, but they're saving, they're paying down their credit card debts and other financial responsibilities. They're not spending.
Not at the level necessary to fuel this economy. And I agree with you wholeheartedly that consumer confidence must come back in order to move this economy forward. And I think that there's some things that need to be done by the federal government. And we're not advocating spending more of consumers' tax dollars, but some of these bad debts that financial institutions have incurred over the last couple to several years have to be addressed in order to free up this money supply for businesses, whether it's retailers, manufacturers. And that's part of helping consumer confidence here. People are going to feel good and better about the economy if they feel better about the stability of their employment.
Well, I don't think there's any doubt about that. I mean, I think one of the deterring features from people spending is just the fact that people are worried about losing their job, and jobs are a lagging unemployment's a lagging indicator. You know, it's our 401ks conceivably will get better before the job picture gets better for most Americans. Pennsylvania's unemployment is a little lower than the national average, but it's still, you know, going to probably be perilously high, and that doesn't help consumers get any sense of confidence either.
Oh, absolutely not. From the information I've received, Pennsylvania, except for California, paid out more in unemployment compensation claims in 2008. I mean, that's very discerning.
All right, we're going to take a quick break. When we come back, I want to talk about a piece of one of Governor Rendell's proposals to eliminate the sales tax on the vendor's allowance tax for retailers. I want to get into that when we come back. This is an important aspect of trying to make sure that we can get the economy stimulated. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program with Brian Reiter. He's with the Pennsylvania Retailers Association. He's actually the head of that organization. Governor Rendell in his budget address, and he's pushing a sales tax on vendors, allowance, retailers. It's got a complicated name. First of all, what is that tax? And then why should people care about it?
Well, Terry, what the governor had proposed back in February in his budget plan was the elimination of a provision in the tax code, which is what is known as the sales tax vendor's allowance.
I get that, sales tax. Go ahead.
And basically what that is a small allowance to anyone responsible for the collection and remittance of the state sales tax to the Department of Revenue. And currently retailers and anyone else responsible for the collection and remittance of this tax receives 1% to help offset the cost directly associated with the collection and remittance of the sales tax.
Let me stop you there. So I'm a retailer. I collect the tax, and then I remit that tax to the state treasury. My payment for doing that is 1% of the 6%. Do I got that right?
No, it is 1% of 100% of the tax collected. If you collect 100% in sales tax, you are permitted to keep $1.
Okay, I got it. Thank you.
Yeah.
That's a good point. Good clarification. Now, is in and of itself that tax a burden?
Well,
I mean, if
the tax is a
tax.
burden from the perspective that it costs retailers and anyone else responsible and mandated to collect and remit the tax.
Okay.
PricewaterhouseCoopers conducted a study that was completed in April of 2006, a comprehensive study that hasn't been disputed by anyone who's reviewed it, that the average cost to collect and remit the sales tax was 3.09%. So retailers are already losing money to act as the tax collector for the Commonwealth. So when the governor came out with his proposal to eliminate the 1% vendor's allowance, which would provide approximately $75 million savings to the Commonwealth, it caused great concern to the retail industry, again, because we're already losing money. And as discussed earlier in the show, now it couldn't be a worse time to propose another hit to the retail industry.
Yeah. We're about out of time, but you would argue it's another burden on the business community at a time when that's
absolutely.
Yep. All right, thanks for the update. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, you all stay well.